Hi, so I am so elated to meet you in the program of 3 p.m. 3-point medics. So far we have been learning about hyponatremia. We have covered few aspects of hyponatremia. I want to recall those points. One, hyponatremia is the most electrolyte abnormality seen in hospitalized patient to an extent of 30 to 40%. When you say hyponatremia, most of the time it is a water accumulation in the body that dilutes the sodium rather than true sodium reduction, and 90% of sodium is present in the plasma, which is the one maintaining plasma osmolality or otherwise called plasma solute concentration. So, plasma osmolality or plasma solute concentration of 90% is contributed by sodium alone rather than potassium, chloride and urea and glucose and so on. So, for all practical purposes, when you have hyponatremia means there is decreased plasma osmolality. When you have decreased plasma osmolality means there is reduction in sodium. What is the consequence of hyponatremia in our body? When you have hyponatremia in our body, your plasma osmolality gets decreased or otherwise called plasma solute concentration gets decreased. On the basis of principle of osmosis, water will move out from lower concentration to higher concentration, that is called osmosis. Now, because of hyponatremia, there is decreased plasma osmolality in the blood. So, water will move out of blood or otherwise called intravascular compartment into adjacent cells. So, there is abundant cell swelling across the body. All the body is able to adapt this cellular swelling other than brain, which is much vulnerable. Since brain has been encased within the stiff structure or otherwise called skull, brain is not able to expand outward. So, all kind of neurological symptoms ensue like seizures, lack of conscious level, and finally they lapse into coma and so on. So, hyponatremia mainly produces neurological symptoms rather than muscular symptoms, unlike hypokalemia or hyperkalemia. Then we have seen excess water accumulation is responsible for hyponatremia. So, three causes of excess water accumulation we have seen. One, wherever ADH is stimulated or antidiuretic hormone is stimulated, like diarrhea and vomiting, or all organ failure including cardiac, renal and hepatic failure. When ADH is stimulated, one, and second one, whenever you have GFR impaired or whenever you have low GFR seen in acute kidney injury, chronic kidney disease and end-stage renal disease. And third one is low solute intake. That means when you take protein lack diet or when you take protein and fruits vegetable lack diet, or when you rely on simply carbohydrate diet, then what happen? You will derive only minimal solute load in the plasma. So, kidney doesn't require much water to excrete this low solute load derived from above diet. So, less amount of water is excreted in the body as urine. So, relatively more water gets accumulated in the body, resulting in hyponatremia, classically seen in beer potomania and tea toast. In both the conditions, people rely simply on consumption of beer and people simply consume on tea and toast. So, these are the causes we have enumerated so far. Now, out of all these causes, now we are able to understand that whenever you find hyponatremia, three important tests you have to order. First, serum osmolality. Why you have to order serum osmolality? Serum osmolality is absolutely determined by serum sodium. So we know that naturally when you have hyponatremia, decreased serum osmolality. So what is the necessity of doing serum osmolality? When you are aware that there will be always reduction in serum osmolality secondary to hyponatremia. Yes, there are few conditions where hyponatremia will be there, but instead of reduction in serum osmolality, you will have normal serum osmolality or increased serum osmolality will be seen. Normal serum osmolality with hyponatremia seen in hyperproteinemia, seen in multiple myeloma and hyperlipidemia, or you have hyponatremia with increased plasma osmolality instead of low serum osmolality, that is seen in hyperglycemia, those who have received mannitol administration and glycine administration during the time of TURP surgery or even during the time of gynecological surgery. These are the conditions patient may develop hyponatremia during the surgical procedure, but instead of low serum osmolality, you will have high serum osmolality. So whenever patient has hyponatremia, do serum osmolality, ensure that there is low serum osmolality. If there is low serum osmolality, that means you are dealing with true hyponatremia, or otherwise I could say you can rule out all these hyperglycemia, mannitol, glycine administration, hyperglycemia and hyperlipidemia, hyperparathynemia, all the causes are ruled out. You are dealing with only true hyponatremia when there is decreased serum osmolality. Now you have ordered serum osmolality. Now you have found low serum osmolality. Then another important investigation is urine osmolality. If you do urine osmolality, we always segregate into two types. One, urine osmolality less than 100 milliosmolality per kg. Urine osmolality more than 100 milliosmolality per kg. If urine osmolality less than 100 milliosmolality per kg, then only three causes. One, beer potamania. Second, tea toast. Or third one, inappropriate IV fluid administration, or otherwise called, if you infuse simply 5% dextrose, or otherwise called plain water, you will dilute plasma sodium by administration of 2 to 2.5 liter hypotonic solution, or otherwise called plain water, that is 5% dextrose, resulting in hyponatremia. So these three causes out of 15 causes of hyponatremia can produce urine osmolality lesser than 100 milliosmolality per kg. Once again I want to insist, out of 15 causes of hyponatremia, if you do urine osmolality, if urine osmolality less than 100, only 3 causes are there. If urine osmolality more than 100, you can rule out these 3 causes. So if somebody has urine osmolality around 250, 300, not less than 100, that means I have ruled out 3 causes. One is beer potamania, second one is tea toast, and third one inappropriate IV fluid administration, or otherwise called 5% dextrose administration. How I can remember urine osmolality less than 100 milliosmolality per kg? How I can remember these 3 causes? Yes, you can remember these 3 causes in literally. I used to teach PG students in such a way that one is tanni party, that is beer potamania. Second one, tea party, tea toast. They will simply rely on taking tea, no food, then they will develop hyponatremia. Tanni party, beer potamania, where they will take only beer, no diet, no food, then they will develop hyponatremia. So tanni party, beer potamania, tea party, tea toast, and administration of 5% dextrose knowingly or unknowingly around 3 liters per day may dilute your sodium. This one you can remember. சென்னையில் they used to say வச்சு செய்கிறதுன்னு சொல்லுவாங்களா, அது மாதிரி நம்ம 5% டெக்ஸ்டோஸை டெலிபரேட்டாக நோயிங்லி ஆர் அன்னோயிங்லி கொடுக்கும்போது அதை வச்சு செய்கிறதுன்னா we remember. So I used to say 3 words: தண்ணி பார்ட்டி, டீ பார்ட்டி, வச்சு செய்கிறது. பீர் போட்டமேனியா, டீ டோஸ்ட், inappropriate administration of 5% dextrose or hypotonic solution. These 3 causes only can produce urine osmolality less than 100. So, when I do serum osmolality, it is low, then I order urine osmolality. If urine osmolality more than 100, I will comfortably rule out these 3 causes. Then rest of the causes, around 12 causes of hyponatremia, then I have to explore with few more investigation. We will see all these in next session. Thank you.